I'm Dr. Jill Vecchio, and I'm a practicing radiologist who's read the healthcare law. Now, we've been going through it. We've done coverage, costs, state healthcare exchanges, how it affects employers, how it affects doctors, how it affects you as patients. We've gone through judicial and constitutional issues, and now we're going to talk about real ideas for healthcare reform. First, let's review some of the things we've learned. First, not everyone will be covered. In fact, the number of uninsured may actually increase. The costs of healthcare and premium costs will increase. Taxes and costs of goods will increase. Government regulation will skyrocket with millions of pages of new regulation. Healthcare will be rationed. Doctors will leave their practices, and Americans will lose their freedom. Now, some of the ideas for healthcare reform, and we're going to talk about all these one at a time. Post prices. Everybody should know what our prices are. Separate insurance from the workplace. Use health savings accounts, or encourage the use of health savings accounts, which is real insurance with catastrophic coverage. Get the government out of the insurance business, including Medicare and Medicaid. Find a way to make those financially viable. Eliminate state mandates or decrease them significantly. Allow people flexibility in the choice of their insurance policies. And we're going to talk about tort reform. So let's get started. So we think that providers should post their prices for services. As it is, if you asked me how much a mammogram costs, I wouldn't be able to tell you because it's different depending on whether they're Medicaid, Medicare, what third-party insurance they have, whether they're paying cash, what kind of a policy they have exactly. So those costs are different for everybody, which is ridiculous. Everybody should know what their costs are. Medicine shouldn't be any different than any other industry. So we say post your prices for everything so people can see. Eliminate the CPT codes, at least as much as possible. Those codes that we talked about increase the overhead for providers and doctors' offices immensely. If we could just get rid of that part of the overhead because we're posting our prices, right? So we don't need those codes if we're posting our prices. So that'll decrease our overhead by somewhere between 5 and 40% for some practices. That's an immediate decrease in the cost of healthcare that can be passed on to patients and consumers. It allows for creative pricing and competition. If everybody's prices are posted, then they can say, oh, well, we're running a special on CTs, or you can have a membership in an imaging center or a membership in a hospital that you can get a little decreases in your prices, little discounts. We can have senior discounts like you can for everything else. Run it the same way you run other industries. Let the competitive pricing of the market system decrease healthcare costs. And also allows for doctors and providers to provide free care. There are actually some limitations in government regulations about who can get free care. Why is that? We should be able to do the same things that any other group does. And if someone is really in need, the American people and the American physicians and the American healthcare system is not going to allow people to suffer needlessly. Health savings accounts. This is real insurance. Right now, about 14 million Americans have health savings accounts. This is, you have a high deductible, somewhere between $4,000 and $10,000 deductible, but you're allowed to save money pre-tax, tax-free, or tax-credited into these health savings accounts that can only be used for medical expenses. Then you have a catastrophic health care insurance plan. And the premium costs for those insurance plans are about half the cost of a standard first dollar coverage or whatever, insurance policy. So that the premium costs are much lower. And I haven't talked to a single person with a health savings account type plan with catastrophic insurance that doesn't love it. So 14 million Americans have it. Now, it's important to know for you 14 million Americans that have it, that Obamacare or PPACA has several parts to it that will severely limit, if not eliminate, your option to have a health savings account in the future. So they have these medical loss ratios, and I won't go into detail about that, but a medical loss ratio that's imposed on the insurance companies that may prevent them from offering very many of these health savings accounts. Some of them are already announcing that they're going out of the health savings account business altogether because they would be violating, they wouldn't be able to comply with that regulation of the healthcare law if they offered a lot of health savings accounts. That's important. Another thing is they have decreased the amount of money you can put into some of the flexible savings accounts, flexible medical savings accounts. And they're increasing the penalty for taking cash out of those for people who have been unemployed for a long time or something, some personal issue that you want to take money out of your health savings account for something other than medical expenses. They increase the penalties for that. So the health savings accounts, in a way, are kind of under fire. So pay attention to that. With the health savings account, you can accumulate a lot of money over time to help pay for your premiums and your deductibles. Patients are in control of the healthcare expenditures from first dollar, which means that they get to shop around. If your doctor recommends some medication and you say, well, how much is it? Well, now that we're posting our prices, we'll know how much that is, right? So your doctor's going to say, oh, well, this is $95 a month. And you can say, you're nuts. Give me something that's $20 a month. Isn't there something out there that you can substitute that'll be just as good, or at least that we can try? Sure. So that puts patients in charge of their health care. That's good. Gets the insurance companies out of the decision-making process until there's a catastrophic event. And that's what we want. That's what insurance is for. Now, we also want to separate health insurance from the workplace. So employers get a tax benefit. They get a tax break when they pay for the premiums for their employees. Why shouldn't individuals get the same thing? Right now they don't. So we're saying, let's give everybody a tax break for medical expenses, including premium costs and so forth. Encourage people, give them incentives to have health insurance. Right now they don't have it. So that's why a lot of people who are self-employed, sole proprietorships don't have the insurance, because they don't get the same tax break sometimes. So we also want employers, and as they do now, a lot of employers pay into the health savings accounts or make an allowance for the high deductible payments. And it kind of works, they can work it like a 401k. It could be a more formalized plan, so that there's actually there are formalized ways for you to invest your money from your health savings account that you're not using. Invest that in a very low risk entity similar to 401ks. Right? So really, the 401k system is a great setup for the health savings account system as well. We already have these things in place and people are used to them. So let's just use it for this. Individuals can keep their insurance when they're no longer working for that employer. This is crucial. That's part of the problem with pre-existing conditions, is because people leave their employer and then they try to get insurance in an individual market, but if they have a pre-existing condition, they can't get that insurance, or the premium costs are outrageous. A lot of times they just can't get insurance at all. So let's separate health insurance from the workplace. It's not to say that your employer can't contribute to your costs for health insurance, but the policy doesn't reside with the employer so that you lose it when you leave that employment or move to a different employer. Right? So theoretically, you could think that people may have a health policy that follows them from their childhood up. It may not be exactly with the same company. We get to shop around, right? So if the insurance companies don't do what we like, they're not treating us like they should, we don't like the way their customer service is run, then we get rid of them and hire another insurance company. Let's say we have insurance companies that are sold across state lines, national insurance. Why can't our health insurance be linked to auto insurance, auto, health, home, life? All those things are packaged together and you did get a discount. Let's add health insurance to that. Why can't you have an insurance policy that just follows you throughout your life? Pre-existing conditions won't be an issue then. Right? Get government out of the insurance business. We've already shown that they're not that good at estimating costs. When Congress has a 13% approval rating, why in the world do we want them running our health care? Really? So let's get the government out of the insurance business. Let's have health savings accounts for Medicare and Medicaid. There are some states that have Medicaid accounts that have the Medicaid patients, enrollees have a little health savings account, so they get to manage their own money. And if they use the money wisely, and if they get off of Medicaid and haven't used up that money, they get to keep it, whatever's left, to help them get started on their own with their health savings account. These are great programs, and they save money. They don't cost more money, they save money. Get Medicare the same way. The elderly are just as good at shopping as the rest of us. You can have people that can help them out. They don't have to be on their own. There will be services that will pop up all over the place to help people shop for health care, right? You'll have an iPhone app and a heartbeat that's going to say, oh, this is the price for CT scans of the abdomen and pelvis with, blah, 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 all over town. And this is the one closest to you, and this is what they're going to charge this week, right? So this is going to be real easy for us to manage, folks. You spend more time looking for a big screen television than you do picking out your health savings account. I did. I admit it. So what we want is people to get a little more invested in their health care. Now, if the government gets out of the healthcare business, this will allow for real control of healthcare costs without rationing of care and limiting reimbursement to providers. Put it in a competitive marketplace. That's how you save money. This is also going to eliminate unnecessary regulation that we've already talked about increases healthcare costs by up to 40%. Eliminate state insurance mandates, or at least decrease them markedly. Some states have lists of like 74 different mandates that they require for every health insurance policy. All that means is that I'm paying for things that I'm not going to use in order to help pay for something that someone else is going to use. That's just another form of subsidy, right? So let's have, in order to make these policies affordable, let me pick what coverage I want. I may be willing to pay cash for a lot of things or take a chance that I'm going to have, abuse problems, substance abuse problems or something, and that I'll pay for those out of pocket, right? But I don't want to pay for premiums to cover that for years and years and years and never use it. So let's let people make their own choices about what coverage they have, and that way they're going to be more likely to have a policy and pay the premiums if they have a choice about how to adjust those premiums and keep them affordable. Tort reform. So we think that there should be panels of judges, say expert physicians and lawyers, that review cases before they go into arbitration and certainly before they go into court. So that these groups, these panels would review a case and find if it's a bona fide case, great. Send it on its way. Let's get payment and reimbursement to the person who's been injured. Absolutely. If it's a frivolous lawsuit, then it doesn't go any further. Any court costs incurred up to that point by the people involved in the case need to be paid by the plaintiff and the plaintiff's lawyer, especially the plaintiff's lawyer, because obviously the plaintiff isn't necessarily going to know it's a frivolous lawsuit. The lawyer should know better. So that's what we want to do. We want to stop the frivolous lawsuits. We want to stop the lawsuits that are filed in spite of the physician and providers doing everything right. So let's talk about what these changes will do. It's going to decrease premium prices significantly. It's going to allow for patients with pre-existing conditions to get coverage and services. It's going to decrease overall healthcare costs. It's going to allow for competition in the marketplace. It's going to allow for transparency in healthcare costs, and it puts decision-making in the hands of the patients where it belongs. The best thing these changes will do is preserve our freedom as Americans. So I'm Dr. Jill Vecchia. We're all done finally with this series. Thank you so much for watching. Remember all of these issues when you go to the polls this fall. Take care.